Somerset County lags behind the rest of Maine for the percentage of those who've gotten that first dose.
Less than 18% of that county's population has gotten a first dose of the vaccine, while other counties are nearing 25 and even 30%. Somerset County has 5 retail pharmacy locations, 2 hospital clinic locations, and 3 federally qualified health care centers, one in Madison, one in Bingham, and one in Jackman. Tonight, we're taking a closer look at how the Maine CDC, DHHS, and county public health officials are trying to help.
Counties of concern are getting as much vaccine as we can push to them.
Those counties of concern include Somerset, Oxford, and even Washington. One problem: the lack of Johnson & Johnson vaccine. Public health leaders say it's ideally suited to rural areas like Somerset County. Last week, Maine got none.
Not having the J&J vaccine this week, that does not help the effort.
This week, Maine received 1,600 J&J doses. DHHS Commissioner Jean Lambrou said they sent more doses to federally qualified healthcare centers. The state is activating as many of those centers as it can.
There are by design in underserved communities, and we think that that's a tactic that will hopefully help address some of our disparities.
The CDC also specifically activated the Walgreens, Walmart, and Hannaford pharmacies in counties of concern.
We're trying to make sure that the existing access points are getting as much vaccine as we can. Is it enough? No. But as supply increases, we'll be able to true that up.
Now, the CDC is trying to make sure there are enough places for people to get a vaccine.
All right, you're all done.
And that the hours are realistic.
Good.
Well, we need to do more there.
On top of that, the state is trying to set up pop-up clinics through EMS units and using the Motive Care Partnership to drive people to vaccine sites. Lisa Caswell, director of pharmacy for Reddington Fairview General Hospital in Skowhegan, says they have had no problem filling clinics. But she and the CDC know that the Johnson & Johnson vaccine will be a primary tool in this effort.
All of that is contingent upon us getting more J&J vaccine. And right now, for at least the next week or week and a half, that doesn't look like it's in the cards.
If you or a family member struggles with using the internet, there are other options to get a vaccine appointment. Somerset County set up its own hotline, and if you call between 9 a.m. and noon, Monday through Friday, you'll get a human being who will help you get an appointment. That number is 207-858-2452. Plus, the state has a similar hotline. That number is 888-445-4111. Staff can help people who struggle with internet get registered for an appointment.